Schools in 23 countries are yet to fully reopen. This affects nearly 405 million school children globally. Experts say the number of children set to drop out of school completely is bound to increase. The number of out-of-school children in South Africa has tripled from 250,000 to 750,000 between March 2020 and July 2021. In Uganda, around 1 in 10 school children did not report back to school in January this year after schools were closed for 2 years. In Malawi, the dropout rate among girls in secondary education increased by 48% from 6.4% to 9.5%. That's between the year 2020 and 2021. In Kenya, a survey of 4,000 adolescents aged 10 to 19 years old found that 16% of girls and 8% of boys did not return when schools reopened. We're joined now by Lieke van der Wiel. She is UNICEF's Deputy Regional Director, Eastern and Southern Africa. She joins us from Nairobi in Kenya. Very good evening to you, and thank you so much for speaking to us. I mean, it's quite a staggering figure to wrap your mind around. 23 countries, is a lot, but when we talk about 405 million children who are yet to fully go back to school or have schools reopened, one would have thought we would have reached a level of normalcy. Why is the figure so high?
Yeah, thank you for paying attention to this important topic, because I think nobody really realizes how many kids globally are still suffering. Reason is that countries still haven't prioritized opening of schools across the globe. It's very unequal. We really talk about the Philippines, the Pacifics, even some countries in Latin America. Now, in our own continent, like you just mentioned, we had actually Uganda closed for almost 2 years. Luckily, they have opened in January, February. But of course, once you are closed for such a long time, the damage has been done to a large extent. Kids have not been learning. In fact, the younger kids went backwards in their learning, their skills and their knowledge. And then the bigger kids, like you said yourself, they are just not coming back. They have found alternative ways of spending the day, maybe some informal work. They lost appetite altogether. They might be slightly depressed because, of course, school is not only learning, but it's also peer support. It's also normal life. And once that's taken away for a significant period, it's very hard to go back to normal like nothing has happened. So this is a little bit what we've seen across the globe, including in our own region. And it's very worrying. It's extremely concerning. And the children are really the silent victims of COVID-19.
If you could just take us through the continent first, perhaps according to the regional blocks, as it were. I mean, I recall, I think it was last year already, the WHO hosted a briefing and was looking at your figures specifically, how the girl child is disproportionately impacted by COVID-19, especially the high dropout levels. But the figures we had then were of Zambia, and they were quite astounding. We haven't even mentioned Zambia in our conversation so far. So why is the girl child the worst affected or the worst victim of the pandemic with this particular issue?
Yeah, what we'll see is actually at the height of the closure in our region, there were 164 million children not in school. Now, when they opened, kind of mid last year, 30 million did not come back. In addition to the 34 million already not in school. So still, numbers are staggering. Now, within those numbers, there's a number of special vulnerable children. And we talk, of course, about children in rural areas who even didn't have any form of connectivity. So they lost connection altogether with learning, with school, with peers. And then within those kids, again, you really talk a lot about girls, especially adolescent girls, that even lost the protection of the school. Actually, going to school, as a matter of fact, is not only learning skills, learning knowledge, numeracy, literacy. It's the peer connection, and it's a protection of teachers that keep an eye out. It's a protection of going every day, same routine. And when you lose that, and especially when you're an adolescent and you find other ways, or there's maybe less protection in the home because parents are stressed, there's maybe some violence in the home or the near family, then the girls seem to suffer the most. There are also instances in countries that we've seen across the globe, including our region, is that actually girls, they fall pregnant, and when they are pregnant, then at a certain stage, it's much harder to get back to school. Luckily, Tanzania, for example, has opened their school now for girls that are pregnant. But nevertheless, it's still quite a big leap to go back to school being pregnant, of having a young child, newborn, since that has another set of challenges. In addition, of course, we see that other vulnerable groups also have a tremendous hard time catching up. Socioeconomic status, for example, if your parents don't have a regular income or can't even help you with education, with homework, that has a big influence on whether you go back or not. And disabled children are also one of those groups that find it very hard to go back, and they lost a lot of learning and a lot of protection.
I mean, what you're saying is alarming, sad, but we already know it, that the inequalities have grown and have been deeply entrenched. And when you are talking about learning loss, what is also equally sad is the fact that the problems, the socio-economic problems that were preventing the girl child, for instance, from going to school, lack of sanitary towels, etc., and being pregnant, which may be as a result of sexual abuse, etc., you have seen that in different societies, it would be said that you can't put a pregnant young girl in the same classroom as other learners, almost as if it's some sort of disease. So what kind of strategies at scale can you apply to deal with some of these issues? What is the different country data telling you on how to approach some of these problems?
Yeah, we of course have always worked with the government and ensuring that everybody, all stakeholders, government, schools, community, parents, and children themselves, they understand that education is a right. So all children should be able to go to school, notwithstanding their particular situation. So that advocacy has, again, in Tanzania, also taken in good spirit, and in fact, girls are now welcome to school. Having said that, I think one of the issues that we did all along was to say, children should not suffer because of COVID-19. And it seems right now that society have taken decisions to protect society at large, protect the public health. But it actually came with a tremendous cost in terms of children learning, children development, children mental health. So we have been working very much on safely reopening schools where and when possible, as soon as possible. At the same time, we said, okay, once you've got them in the schools, try to keep them and also make sure that you connect with them where they need to be supervised and guided towards more learning, towards better mental health. Because don't forget, mental health has suffered a lot. Kids have worried tremendously. They lost on many occasions connection with their peers, connection with their teachers. And often they were even in homes that were quite stressed because one of the parents had lost their jobs and they actually didn't know where the next paycheck was coming from. So that environment was not very conducive for children to be able to learn. So we've been working with schools, with communities, with governments. And now once the kids are in school, it's also a matter of having accelerated learning. So that yeah, go ahead.
No, please complete your train of thought.
Yeah, the accelerated learning is very important because what you have now is an opportunity to connect directly to the child, where it has left, how much it has retained its learning, and how can you now accelerate what it should learn. We have seen, like you mentioned, across the board, a decrease in learning. So the learning loss has increased in our region, which means that a child of 10 can't recognize normal numbers or read a simple text, and that should not happen. So we need to sit down with those children and really make sure that they accelerate their learning and reach where they should be at this age and in this grade. And that needs a lot of patience, and that needs a lot of extra resources. A teacher needs to be individualized, guiding the student. And you really need to have patience, because the last thing you want is the kid get demoralized, and next thing is that they don't want to come to school, or they don't get motivated to learn more. Right. So these are some of the challenges that the schools are facing.
So before we also delve a little deeper into the pedagogical tools or strategies that countries or schools in general can employ, I want to go back to the psychosocial health aspect, because, and I want to find out from UNICEF what your officials have found, especially through whatever data collection you've done. Has there been a resistance, especially from a cultural perspective? Because there needs to be the requisite level of empathy. We've been talking about the mental health aspect of COVID-19 and how this could be the other silent pandemic. So do you find that there is a pushback, a rejection of that, trying to put in place psychosocial health strategies because of a lack of empathy or refusal to accept that some of these things may seem insidious but can have long-standing impact on the psychological health of these children?
Yeah, that's a very good question. And I think, to be honest, that there's more and more acknowledgement that the impact of the COVID-19 was way beyond physical impact. And the mental health impact has been featuring quite a lot over the last 2 years. And I would say that's a positive thing out of all this suffering that we have seen. Mental health has become much more accepted. It is now an issue that people are aware of, that it happens, and it has a direct impact in the well-being of children, but also their learning and the well-being of families. The next step, though, is what to do. And I think some of the issues that we see is that UNICEF always connects with adolescents and have them connect with their peers, let them express themselves. And that has grown tremendously. So that is some of the platforms that are being used for children to be able to process what they have gone through. At the same time, we do a lot of training together with the governments and with schools to the teachers to make them realize what it is to take care of mental health, recognize when kids are really in dire need, but also to have some positive ways of working in the classroom to touch upon those issues. So little by little, I would say the awareness is increasing. Now, the resources, though, and that is, of course, the challenge, you do need social workers in schools, social workers outside schools for referral if the school really can't handle it, different resources to take care after school hours, for example, and ability to reach out to the parents, because very often it's not only the child suffering, but it is a reflection of the whole family. And the resources, we really need to invest all together, that we acknowledge how important it is to put resources there in terms of manpower, in terms of understanding, in terms of resources, training, and really make it an equal part of a healthy education and learning experience of children.
Mr. Ms. van der Wiel, thank you so much for speaking to us. So really look forward to speaking to you again about this very important issue as we continue keeping our focus and attention on it. This is our leaders, current and future. So if you look at those figures, quite alarming, as we mentioned, more than 400 million that are still yet to go back to school.